Hello everyone. Today we are here with Dr. Vijita to talk about an important topic, cardiac rehabilitation and why it is important. In the last few years, heart problems and cases of cardiac attacks have increased drastically. However, sadly, only a limited chunk of this population is aware of the cardiac rehabilitation and how essential it is for a full recovery. Cardiac rehab can help in regaining stability, preventing depression, and increasing energy and strength to make daily activities like carrying groceries and climbing stairs easier. So, I would like to start by asking the most basic question from our expert here. What is cardiac rehabilitation and why it is done?
Thank you, Sunidhi. Cardiac rehabilitation or cardiac rehab in short is done after any cardiac event such as heart attack or any kind of cardiac surgeries, especially open heart surgeries or the process of stenting. So one can avail cardiac programs even if they are just diagnosed with some kind of heart conditions and they did not undergo any kind of surgeries. They can also avail cardiac programs in case if they are having any kind of implantable devices such as pacemakers. Now comes the question, why is it done? After all these procedures which I explained above, the main problem which happens is the supply of fresh oxygenated blood to the other parts of the body by the heart is compensated. If we talk in medical terms, that is called the ejection fraction. That is reduced considerably after a cardiac event. So cardiac rehab helps in understanding one's condition, recovering
Hmm.
from surgery, procedures, or heart attack, making changes in your lifestyle that will improve your heart health, reducing the risk of further heart issues,
Right.
and the psychological aspect of living with a heart disease is a big thing, is a big trauma to the family and the patient as such. So that is also taken, that there is proper counseling during cardiac rehab which is given, and it is as important as taking your medicines after any kind of cardiac illness.
Right. It is amazing to notice how cardiac rehabilitation can help in restoring normal life after a heart disease. Can you also shed some light on how long does it take for one to, get better after a serious heart attack or, serious heart condition with help of rehabilitation?
Cardiac rehab programs last up to 10 to 12 weeks, and the sessions can be taken 2 to 3 times a day for about 45 minutes. After any kind of cardiac procedures, when the patient is in the ICU after the procedure, the cardiac rehab starts from that time itself, and it goes up to the patient when the patient is discharged from the hospital and continues to get back to his lifestyle.
Right. So sadly, as you mentioned that it is important, right? But a lot of patients don't go through cardiac rehabilitation. So do you think it will have any long-term effects on them? And if yes, then what will be those long-term effects?
See, we focus a lot on having the proper cardiac medications after any kind of heart illness. So, the importance which we give to any kind of medicines after cardiac illness, the rehabilitation holds the same importance. For us to get back to the previous lifestyle, or to, as you mentioned in your introduction, for simple activities such as taking your groceries to your
Hmm.
climbing stairs or doing any kind of daily activities. If suppose after your cardiac illness you have shortness of breath, or you have problem in standing up for a long time, you have problem in walking for a long time, you cannot hold your breath for a long time. So all these issues can be resolved if you undergo cardiac rehabilitation. What I want to suggest is, as patients give importance to the medications after any kind of heart disease, rehabilitation
Right.
holds the same importance. It helps you to get back to your lifestyle, and it is
Hmm.
conditioned and designed according to your age, according to the present condition, according to the procedure which you have undergone. So you don't have to worry that you will be subjected to very heavy kind of exercises post your procedure. So it is designed and customized according to you, and that is why this rehabilitation is very important after any kind of serious cardiac procedures.
So, ma'am, like you said a lot of, you explained a lot of factors, but another undeniable factor is nutrition and food. Food gives us energy and it is required for almost all the body functions. So, what role does nutrition play in rehabilitation?
So, see, any cardiac illness develops if you speak about blockages in the heart. So, that is a result of cholesterol. Develops inside the body. I mean, the arteries can be jammed with the atherosclerosis, which is the medical term for this, or this the blockaging of the arteries starts even after the first decade of our life. That is a very small age. We do not consider that somebody can get a heart disease in that age. I'm not saying that you get a heart disease in that age, but the blockages and the sclerosis around the arteries start at such a young age. So the nutrition and the correct type of nutrition plays a very important role in having a good heart health. So patients who have had a cardiac event may need to reduce their cholesterol intake or lose weight among other dietary goals. So some key points which I want to focus on is nutritional counseling is often essential for patient recovering following a cardiac event. And the main nutrition which are involved are iron, vitamin D, and these can be sourced from supplements or whole foods. Now, the correct quantity or the which has to be consumed for these nutrients is also explained by the dietitian or the nutritionist who is involved in your rehab program. Also, there's a certain lifestyle in every household which is followed. We use a certain amount of oil. We use certain
Mm.
amount of spices. So, how to reduce those? How to reduce those ingredients in making your daily food is also counseled and told by the dietitian after a cardiac event. So these are some of the important role that nutrition plays after
Mm.
any kind of cardiac illness.
Well, you have beautifully explained the ins and outs of cardiac rehab, and I think I would like to end this session here. It was amazing to have you with us, and I would like to take a minute to tell our audience that if you or your loved ones are looking for the right cardiac rehabilitation plan, we can help you. MediRehab has customized evidence based plans for patients. The team works closely with the patient to ensure full recovery, and the best thing is you can avail our services both online and in clinic mode. So that's it for today, and stay in touch with us for the upcoming sessions. Thank you, Dr. Vijita, for joining us.
Thank you, Sunidhi.